Good morning, everyone. Today, we're going to discuss a very important drug category, which is calcium channel blockers. So before we get to the question, I'll introduce you to how calcium channel blockers work. Normally, in the heart, this is the SA node, which generates the electrical impulse. This is the AV node, which transmits the impulse from the atria to the ventricles. And this is the myocardium, which helps the heart muscle contract. Now, in the SA node, there are channels, gate-like structures called calcium channels. Calcium enters the SA node through here, and these same channels are also found on the AV node. So calcium enters the AV node, allowing the impulse to conduct from the atria to the ventricles. And these same gates are also present on the heart's myocardium. So there are calcium channels there as well. These are known as SA node calcium channels, AV node calcium channels, and myocardial calcium channels. If calcium enters the SA node, it means the SA node will generate the electrical impulse. And if calcium enters the AV node here, it means the AV node will allow the impulse to transmit from the atria to the ventricles. This leads to proper conduction, proper heart rate generation, and if calcium enters the myocytes of the myocardium, then the contraction will occur properly. But if we give a calcium channel blocker to the patient, then these blockers will come and block those channels. If they block the channels, it means calcium cannot enter into these structures. So after giving the calcium channel blocker, calcium can no longer enter the SA node. This means the heart rate will be slower than normal. And if the drug blocks the calcium channels on the AV node, it means the AV node can't transmit the impulse from the atria to the ventricles properly. This means the heart rate will be low. And the calcium channel blocker has blocked the calcium channels on the myocytes in the myocardium. It means the myocardium cannot contract effectively. After administering a calcium channel blocker, the heart rate will decrease, the rate of conduction will be reduced, and the force of contraction will also be reduced. So we can say that calcium channel blockers are negative chronotropes because they reduce the heart rate, and these calcium channels also reduce AV conduction. This means we can say that calcium channel blockers are negative dromotropes. Additionally, calcium channel blockers reduce the force of contraction. This means we can say that calcium channel blockers are negative inotropes. So we can divide calcium channel blockers into two main categories. Some of them act primarily on the heart. These drugs include things like Verapamil and Diltiazem. Verapamil and Diltiazem. But other drugs, other calcium channel blockers, have a specific suffix at the end of their name. That suffix is dipine. So all the drugs that have dipine at the end of their name are known as calcium channel blockers. However, they will only act on the arteries. So here we have an artery, and within the artery, there are also calcium channels. These allow calcium to enter into the smooth muscle cells. And after that, the smooth muscle contraction occurs. But if we administer a calcium channel blocker, then those calcium channels will be blocked. Now, calcium can no longer enter into these smooth muscles of the arteries. This means that since calcium is required to contract the artery, if the calcium is not entering the smooth muscles, then the smooth muscles will remain relaxed. This means the smooth muscles will dilate. So vasodilation will occur, especially within the arteries. But not all calcium channel blockers work in this way. However, we can say that all drugs in the dipine category, meaning all calcium channel blockers with the suffix dipine, will act only on the arteries, such as Amlodipine, Nifedipine, Nicardipine, and Nifedipine. So all the drugs, all the calcium channel blockers that have the suffix dipine at the end mean that they will act on the arteries. This means they will dilate the artery and relax the arteries. So they will reduce the blood pressure by dilating the arteries. So we will give this drug to reduce hypertension they have no effect on the heart. They only have an effect on the arteries. They will dilate the artery and reduce the blood pressure. But drugs like the calcium channel blockers, Verapamil, and Diltiazem, they work only on the heart. This means they will reduce the heart rate, the conduction, and the contractility. This means they will reduce the blood pressure. They will treat tachycardia and any conduction-related problems like atrial fibrillation or atrial flutter or supraventricular tachycardia. Then for conduction, we need to use a calcium channel blocker so that the conduction will be slower. All the dipanine calcium channel blockers contain a structure like this. And this is called a pyridine ring. And on this pyridine, there are two hydrogens. This means for two, we use the word di. And for hydrogen, dihydropyridine, a dihydropyridine calcium channel blocker. So all the dipin drugs are called dihydropyridine calcium channel blockers. But the calcium channel blockers, other than the dihydropyridines, are called non-dihydro pyridine calcium channel blockers. So now we have to go and solve the question. A nurse is preparing to administer Verapamil. This means it will work only on the heart, not on the artery, for a client. Which assessment finding would require the nurse to hold the medication and notify the healthcare provider? This means when we have to withhold this medication, blood pressure is 130 over 80 millimeters of mercury. This is the normal reading, so we don't need to withhold. Heart rate is 52 beats per minute. Yes, for rate. This means it is below normal. A normal heart rate is 60 to 100. So there is bradycardia. If you continue the Verapamil, then there could be severe bradycardia. So that will be the correct answer. As we know, calcium channel blockers work on the SA node, and they reduce the work of the SA node. This means the heart rate will be lower, but it can lead to severe bradycardia. Respiratory rate, 18 breaths per minute. 18 breaths per minute is normal. Temperature is 98.8 degrees Fahrenheit. This is also a normal reading. Which client would be at highest risk for complications from Diltiazem therapy? We discussed earlier that Diltiazem is a non-dihydropyridine calcium channel blocker. This means it will work on the heart rate. This means it will reduce the SA node's work. So it will reduce the heart rate, it will reduce conduction, and it will reduce the heart's contraction. The question is asking which client would be at highest risk for complications from Diltiazem therapy. A client with hypertension. If the patient has hypertension, then we are giving this to treat the hypertension, because if the heart rate is reduced and the force of contraction is reduced, then cardiac workload and cardiac output will also be reduced. And because of this, the heart rate will also decrease. So calcium channel blockers can be given for hypertension. So there is no risk if we give it for hypertension, so we will eliminate this. Client with stable angina. Stable angina is a condition in which the myocardium is suffering from low oxygen. So it means demand is high, but supply is low, and the engine is stable. This means the pattern of angina is predictable. It may be that if the workload is increased, then the angina worsens. But if we give a calcium channel blocker, it means we saw in the previous question that calcium channel blockers reduce heart rate and the force of contraction. This means they will reduce the heart's workload. Cardiac workload will be reduced. This means the demand for oxygen will be reduced. So stable angina will subside. So we can give it to a client with stable angina. So there is no risk. Client with second-degree heart block. If there's a second-degree heart block in the client, what do we mean by heart block? Second-degree heart block. This is our heart, and this is the SA node and the AV node. So in a second-degree heart block, it means suppose 10 impulses are generated. Of those 10 impulses from the atria, only 8, 9, or 7 reach the ventricle. This is a second-degree heart block, and this occurs due to an abnormality in the AV node, meaning the AV node is not working properly, or we can say that the AV node is working less. So if we give Diltiazem, which specifically works on the heart only, so Diltiazem, and we know that. We know that Diltiazem and Verapamil work on the heart, and they reduce the work of the SA node, the work of the AV node. It means the work of the AV node will be reduced. It means the conduction will be further reduced. If the conduction is reduced, there is also an AV block. And if the conduction is reduced, then the second-degree heart block will worsen. So we should not give diltiazem to a patient who is suffering from a second-degree AV block. A client with a migraine headache? Yeah, we can give it to a client with a migraine headache. A client taking amlodipine? Amlodipine. It contains the dipine. It means these are calcium channel blockers that will work on the blood vessels. They will dilate the blood vessels, especially the arteries. Reports swollen ankles. Swollen ankles? At the end of the day, which explanation by the nurse is most appropriate? Appropriate? It means you have to select a correct statement by the nurse regarding amlodipine in relation to ankle edema. You have to know that amlodipine is a calcium channel blocker. That dilates the arteries. If they dilate the artery, it means more blood will go through the arteries and more blood will reach the capillaries. If more blood reaches the capillaries, then more blood will come out from the capillaries into the surrounding tissue. It means there will be edema. So peripheral edema is the expected side effect of all calcium channel blockers that end in dipine. Your kidneys are failing? No, this swelling's not due to the kidney. Due to kidney failure, the medication causes arterial dilation, allowing fluid to leak into tissues. Yes, this is the correct statement. You are experiencing a blood clot. This is the wrong statement. And the medication is causing dehydration? No. A nurse is teaching a client about Verapamil. Again, Verapamil is a calcium channel blocker. And you know that Diltiazem and Verapamil specifically work on the heart only. So they will reduce the heart rate, they will reduce conduction, and they will reduce the force of contraction of the heart. Which statement by the client indicates understanding of the teaching? So we have to select the correct statement regarding Verapamil. I should expect frequent diarrhea. No, if the patient is taking a calcium channel blocker, you have to keep in mind that for smooth muscle contraction, we need calcium. As the calcium enters the smooth muscles, then there will be contraction in the smooth muscles. If the calcium is not entering the smooth muscles, then the smooth muscles will not contract. So smooth muscles will be relaxed. So you have to keep in mind about diarrhea. So it is related to the GI system or related to the intestine. So the intestine also has smooth muscles. And if the calcium channel in the smooth muscles of the intestine is blocked by a calcium channel drug like Verapamil, then calcium cannot enter the smooth muscles of the intestine. It means the smooth muscles of the intestine will not contract. So it will not contract. Then the peristalsis. So the peristaltic movement in the intestine will be reduced. If the peristaltic movement is reduced, it means the food content in the intestine will stay longer. If it stays longer in the intestine, it means the water from this food content will be reabsorbed from the intestine into the blood. It means then the fecal content will be too thick, and so there is less water, and the peristalsis is also reduced. It means we can say there will be constipation. If a patient is taking a calcium channel blocker, and this is especially seen with the Verapamil calcium channel blocker, but there will be no diarrhea. So this is an incorrect statement. I may need to increase fiber and fluid intake. Yes, if the patient has a chance of constipation, then we need to increase fiber and fluid intake to prevent that constipation. This is the correct statement. This medication will increase my heart rate. As we know, calcium channel blockers are negative chronotropes. It means they reduce the activity of the SA node. It means the heart rate will be reduced. No, it will not increase. Swollen ankles are the most common side effect. If we don't understand that calcium channel blockers are divided into two categories, then we will get this question wrong. Because if you understand that calcium channel blockers cause vasodilation, and then there will be ankle edema or peripheral edema. So then you would also mark this answer as correct. But here, in this situation with Verapamil, this is not the correct statement. Because you have to divide calcium channel blockers into two categories. One that works on the arteries and one that works on the heart only. So you have to keep in mind that the calcium channel blockers that dilate the arteries will have side effects like peripheral edema only. But the calcium channel blocker that works only on the heart, only, it means they will not cause peripheral edema. So you have to divide calcium channels into two categories. So here we are talking about a calcium channel blocker, but this is verapamil. It means this is a non-dihydropyridine calcium channel blocker. So it'll work on the heart only. It will not dilate the arteries. So there will be no ankle edema. So this is also an incorrect statement. A patient with atrial fibrillation is prescribed Diltiazem. Atrial fibrillation is a condition where the atria start generating too many impulses, and the SA node also generates them. Under normal conditions, the SA node is what generates the impulse. But in atrial fibrillation, despite the SA node, the atrial cells also start firing on their own, and the heart rate can go up to 200 or 250 beats per minute. So a patient with atrial fibrillation is prescribed Diltiazem. Diltiazem is a calcium channel blocker that specifically works on the heart only, not on the arteries. Which outcome indicates the medication is effective? So we need to select the correct statement. We need to choose the option that shows the medication is working properly. Heart rate decreases from 142 beats per minute to 84 beats per minute. This means there was tachycardia earlier. But after giving Diltiazem, the heart rate has decreased and reached a normal level. This means, so we can say that the medication is working properly. Blood glucose decreases. This is not related. Urine output increases. This is not related. Oxygen saturation increases from. This is also not related to Diltiazem. Which statement best explains why calcium channel blockers reduce blood pressure? So why do calcium channel blockers reduce blood pressure? They increase sodium excretion. No, they do not increase sodium excretion. Sodium excretion is mostly done by certain types of diuretics, like loop diuretics. So with loop diuretics, sodium is excreted. They stimulate the beta receptors. Beta receptors are receptors located on the SA node and AV node in the heart, and also in the lungs. If the beta receptors are stimulated, the SA node starts to generate excessive electrical conduction. So that means the heart rate will increase, and beta receptors are also found in the ventricular wall. This means the ventricle will contract more forcefully. If the ventricle contracts forcefully, it means cardiac output will increase. If cardiac output increases, then the blood pressure will increase. So we can say that calcium channel blockers don't stimulate beta receptors, but rather they block calcium channels on the SA and AV nodes, and in the heart's myocardium. They relax arterial smooth muscle. Yes, they relax the smooth muscles of the arteries by blocking the calcium channel. So this is the correct one. They increase blood volume. They do not increase blood volume. A nurse is caring for 4 clients. Which client should receive the prescribed dose of verapamil? So to which patient can we give verapamil? Verapamil is a calcium channel blocker that works specifically on the heart. So heart rate, 48 beats per minute. Keep in mind that when we give verapamil and Diltiazem, they reduce the heart rate, conduction, and force of contraction. So we cannot give it to a patient who is already suffering from bradycardia. The heart rate is 48 beats per minute. That means this is bradycardia, so we can't give it or it will lead to severe bradycardia. Blood pressure of 84 over 50 millimeters of mercury. We must keep in mind that verapamil also reduces the force of contraction. This means verapamil is a negative inotrope, meaning it will reduce the force of contraction. If the force of contraction is reduced, the cardiac output will decrease. If the cardiac output is reduced, there is a risk of hypotension. So if we give it to a patient who is already suffering from hypotension, verapamil will worsen the hypotension. So we shouldn't give it to a patient suffering from hypotension. Third-degree heart block. Heart block is a condition in which the impulses from the atria are not reaching the ventricles. This is third-degree block. Third-degree heart block. If we give verapamil to the patient, verapamil is a negative dromotrope. This means it reduces conduction through the atrioventricular nerve, meaning it will reduce the work of the atrioventricular node, and the job of the atrioventricular node is to transmit impulses from the atria to the ventricles. So the patient is already suffering from third-degree heart block. This means impulses aren't transmitted to the ventricles via the atrioventricular node. If we give verapamil, this condition will worsen, so we cannot give verapamil to a patient suffering from third-degree heart block. Heart rate of 78 beats per minute. That means the heart rate is normal and blood pressure is 128 over 78. This means we can give it. So we can give verapamil to this patient.